Never compare your own parenting skills with those of your friends. You're all individuals, you're all going to develop your own style and abilities, and your child is going to be different from your friend's child. Never compare your child's abilities with those of his friends. This is really important because children develop at different speeds, they have different strengths and weaknesses, and they are all individuals. When your child displays challenging behaviour, always remember which of you is the parent. And you should always follow your instinct. If a baby wants to be picked up, pick them up. But there will be times when the baby needs to be put down. They'll need to go to sleep. A baby does need some rest, does need some sleep, and you do need to pick up on your baby's cues. So I have seen parents who are just constantly waggling rattles in front of their baby's face.
Hello and welcome back to this Uni podcast episode with me, Dr. Saranya, and our guest expert, consultant paediatrician, Dr. Sue Laurent. In part 2, we'll be talking about your baby's first months outside the womb, going beyond Dr. Sue's baby development journey with Uni to answer some of your burning questions as well as my own. So, let's take a look at Uni's baby development journey.
A baby's first year is one of the most exciting times in a parent's life. Babies grow and change more in their first year than at any other point in their development. But it will be a while before they can tell us exactly what they want or how they feel. So it's up to us as parents to understand their development and try our best to meet their needs. My name is Dr. Sue Laurent, and I'm a general paediatrician and a published author of several baby books, including the parenting guide for mums and dads, Your Baby Month by Month. I've been working as a consultant paediatrician since 1993, and after helping thousands of families with all sorts of development and health-related issues, I'm now going to help you from the comfort of your very own home. In this journey, I'll be taking you through your baby's mental, physical and behavioural development across their first year of life, watching as they go from tiny newborn to adventurous toddler. We'll be exploring the various milestones and time frames your baby is expected to go through and help you to identify any problems along the way. By the end of this journey, not only will you have a better idea of what to anticipate and when, but some conclusive answers to some of your biggest baby development questions.
Welcome back, Sue. I'm
Hi,
delighted
Saranya.
to see you again.
Hello.
Now, I'm sure the majority of the questions you get asked about baby development fall under the category of, is it normal? Something you mentioned in your journey is about how parents can become quite fixated on a baby's weight, for example, and whether they're growing at the expected rate. And I really like the way you've reminded our viewers that every baby develops at their own pace, and that perhaps in this age of social media, it can be a lot of cause for worry when you're comparing your children to others.
Certainly. And if the more you look and the more you find, this is the earliest point at which a baby might do something. Most parents will want their baby to be doing something at that earliest point. And I'm constantly reminding them that actually there's a big range of normal. And what we want as doctors is for them to do that bit of development by the latest point.
And what about if the baby isn't meeting those milestones at that latest point?
So at that point, it's worth keeping an eye on the baby and really looking at them, perhaps in some detail, examining them quite carefully and working out, is there a reason for that? Or is it perhaps because the baby was born a bit early, or maybe because the baby had been a bit unwell early on and needs to do a bit of catching up?
In the book you wrote with your husband, GP Peter Reeder, Your Baby Month by Month, you mentioned the golden rules of parenting. Can you tell us a bit about those?
Yes, my first golden rule, and it's not mine, it was a very famous paediatrician called Donald Winnicott who said this, that the best environment for a child to grow up in is one which is high in warmth and is low in criticism. And it's something that's well worth us all remembering as parents.
Absolutely. And I think that's really important because encouraging our children is really important.
So my next golden rule is never compare your own parenting skills with those of your friends. I think that there's an awful lot of competition out there between parents, and also an awful lot of judging yourself according to other people's parenting. So just remember, you are who you are, follow your instincts, and your child has the needs which only you can understand. You're all individuals, you're all going to develop your own style and abilities, and your child is going to be different from your friend's child. Never compare your child's abilities with those of his friends. This is really important because children develop at different speeds, they have different strengths and weaknesses, and they are all individuals. I love the next one, and that is, when your child displays challenging behaviour, always remember which of you is the parent. This is so important because it's so often that you see parents having an absolute hissy fit over their child's bad behaviour, when all you need to remember is stay calm.
Thank you, Sue. Those are all in themselves so important. And I love the way that you've pulled together different resources to come up with those golden rules for parenting. So the physical development section of your uni journey is fascinating. There's no time where your child changes more rapidly than the first 3 years of life. Parents often refer to milestones as per their baby's age, but of course, if the baby is born earlier or later than expected, those might change. How do you advise parents with milestones on those?
I think this is really important to understand. So if you've had a baby who's been born early, you're not going to expect them to achieve the milestones at exactly the same stage. And they will just, if you have to simply take away the number of weeks early that they are, and so therefore work out when they should have been born, and then work out what the milestones should be after that. What's really interesting is that premature babies actually do a lot of catching up. So often by the time they're a year old, they'll be doing just what an average year-old baby would be doing.
And so at what point would you then start referring to the regular milestone age?
So I would guess roughly from a year. I mean, it depends on how premature a baby is. But roughly from a year, a lot of babies will have caught up.
Okay, that's really helpful. So many mums will be surprised to learn from you that rolling can be a stage that babies maybe don't pass through. Are there any other milestones that you could skip?
Interestingly enough, yes. I mean, crawling, sometimes it gets skipped. So sometimes you get a baby who sits and maybe they then bottom shuffle and then they walk, or maybe they just go straight to standing. It's really fascinating what a great variety of types of development there are in babies, which are completely normal.
And so I guess there's not really a one-size-fits-all for milestones either.
No, there isn't.
Have you encountered any children who are particularly stubborn to stand or start walking, and how do you support those families?
So there's a group of children, and they're often what we call hypermobile children. And they're the babies who, if you feel them, they sometimes feel quite floppy jointed and they're quite bendy. And they're the babies who tend to not crawl, tend to not stand early. They might bottom shuffle, and they may not walk until they're about 18 months or 2 years old, sometimes not till they're 2, which is quite late, but still normal. And it still means that they will be normal and they will achieve, they could be a footballer if they want in the future. None of that's going to hold them back.
And that's very good to note. So recently in the emergency department, I came across a baby who came in with a cold and some breathing difficulties. And at the same time, Mum had started to read about tummy time, and she wanted to encourage this that same week, but noticed, as you might expect, that because he had a cold, his breathing got worse when she put him on his tummy and he didn't enjoy it. Now, that was a reason for him to not enjoy tummy time, but she did say in general that none of her babies really enjoyed tummy time. Do you come across that a lot?
A lot, yes, because I suppose we put babies to sleep on their back now, so they're used to being on their back and they can sort of look out And a lot of babies just hate being on their tummy. And I think the important thing is just to give them a little bit of time, but don't leave them there to be really miserable. So encourage it, but don't force it.
In your journey, you discuss about the advantages and disadvantages of dummies, and that's something that I'm particularly thinking about a lot at the moment. I just wondered, from your experience as a mother, where do you stand with the dummy debate?
It's a really good question. So what I don't like, this is my personal view, is toddlers running around with a dummy in their mouth and therefore not talking because they've just got a dummy in their mouth and they're sort of plugged in all day long. I think there's absolutely is a use for dummies, particularly at night as a soother, or at other times as a sort of soother in a small baby. There is some evidence that having a dummy makes you less likely to have ear infections, because I think it's because the babies keep swallowing, and it could be useful on a flight, for example. And it may help with baby's sleep as well, if baby is soothed easily with the dummy and goes back to sleep. So I think it's a personal choice.
But did you use a dummy with your own children?
I tried with one of them and he wasn't that keen, and the other two weren't keen at all. So I did offer them a dummy at one point, but I didn't really persist because I was quite glad in many ways they didn't want it.
And that's what the advice says, that if a child is not keen on the dummy, that you shouldn't force it.
Exactly.
And we see a lot of babies with teething pains. Can a dummy help with that?
Yeah, I mean, sort of gnawing on things. So there are cool things that you can put in a mouth, which helps with teething pains. So yeah, a dummy might be helpful with that. But you don't need to use a dummy for teething pains.
So growing up in a Sri Lankan household, I was used to hearing my parents speak to each other in Tamil. But of course, they also spoke to me in English. And so growing up, I learnt to understand both Tamil and English, and then spoke predominantly in English. Many of our listeners will also be in the same position where there may be even more than 2 languages spoken at home. How can having multiple languages in the home affect your speech development?
It's absolutely wonderful to grow up with 2 or more languages in the home, because if you, during the stage of early brain development, you're much better at learning language. And if you learn 1 extra language as a child, it's much easier to learn extra languages as an adult. So I would strongly encourage it. Sometimes children seem to acquire language in a slightly slower way because they're listening to 2 languages. But as long as they're within the normal limits, I wouldn't be worrying at all. And I have never seen a disadvantage of having 2 languages in a home.
And that's interesting that you point that out, because that's something I hear quite a lot in the emergency department, that my child is not yet speaking, but actually we speak 4 languages at home. And often I reassure them that it may take a little bit longer because, as you say, there's a lot more going on in that little brain, but that they will catch up. So on the topic of language, baby talk is something that I heard a lot growing up when family members would be talking to my younger cousins. And I always found it bizarre listening to them use these incomprehensible sounds and broken sentences, whereas I would always speak to younger babies, as I do now with even newborns in the hospital, in full sentences. Is there a difference? And is it important that you speak to babies in sentences with proper grammar?
I completely think you should speak normally to babies. I don't believe in baby talk. I mean, I don't criticise people who want to talk to babies in a sort of baby-like way, but I just think that they're learning all the time, and they're amazingly perceptive babies, and they understand way before they can speak. So you might as well speak to them how you want them to understand.
Yeah, and that's really good advice. So I'm glad that's what I've been doing all along. So you cover a fascinating section on behavioural development, and particularly I'm keen to know whether babies are born with a specific personality.
I think that's a really good question, and I personally think that they are. And if you talk to parents, they will often say right from the beginning, my baby was very calm, and they have continued as calm babies, just taking everything in their stride, whereas some babies are born seemingly very anxious, and quite often they turn into anxious children. But what I also think is important is that if we have a baby who cries a lot and is very fussy and is maybe vomits a lot and is hard to feed, I think how we interact with them is really, really important, because if we label them as difficult, and if we treat them in a way which is perhaps that they're slightly less likable, then that will influence their personality. So I think as parents, we've really got to be as calm as we possibly can, even if our babies are crying a lot in the first 6 months or so.
That's really helpful. As you may know, Sue, I am an only child, and I have to say, in comparison to some of my cousins, I was definitely classed as being a bit spoiled. Now, I'm interested to hear that you talk about how babies could be spoilt by being held too much. And I wanted you to talk to us a bit more about that.
Oh, well, I'm not sure I'd necessarily say spoilt, but I think that babies do have to get used to being put down at times. I mean, babies are born able to engage us as much as possible. It's all about self-preservation. So what they will do is they will want us to hold them as much as possible. And you should always follow your instinct. If a baby wants to be picked up, pick them up. But there will be times when your baby needs to be put down. They'll need to go to sleep. And I see so many parents who have found a way of getting their baby to sleep by just sitting in a chair and having them sleep on them all night because they can't put their baby down. I'm not sure I'd use the word spoilt, but I would be worried about that. It's actually also not safe to sleep with your baby in a chair with you.
And again, on the topic of being an only child, I was particularly interested in your episode on sibling introductions in the journeys. And I would love to know a bit more about how you introduced your siblings to each other.
So I love that story, because my eldest one waited a long time before the next two came along. And he really, really, really wanted a baby brother or sister. And he was very excited. So he kind of shared in the journey with us. And from very early on, I allowed him to do a massive amount. And not just allow him to, he actually wanted to change nappies. He wanted to walk around with her strapped on his front and take her to school. So there was never any rivalry there. It was all about, this is my baby sister. The next two were 3 years apart. But actually, my daughter loved having her baby brother because she was old enough to understand that he was exciting. He was a baby for her as well as for all of us. I think sometimes the smaller gaps are harder because there's less understanding and more envy. And then you have to be really careful that the child who's that the older sibling is given as much attention as the baby, because they so often feel left out.
And let's talk about that when you've got lots of children in the household, or for example, if you've got twins. How do you encourage parents to be able to celebrate each of their milestones distinctly without comparing them?
That's really important. And I think it's just a constant reminding that each is an individual and each is going to do things differently, and they're going to have their things they do wonderfully and things that they struggle with, things that they're anxious about. They're going to have different personalities, but everything is exciting.
And that's a lovely piece of advice. I think we have to remember that each child is individual and encourage everything that they do. And that's a really good way of maintaining positivity. So something that you talk about in your journeys is mental development. And I think as a society, we are definitely more aware of mental health. Have you found that there are any particular worries that you come across from parents, especially on the topic of mental development?
Yes, that's really interesting. I mean, I've noticed recently quite a number of parents coming to me with a baby saying things like, I don't think my baby's pointing, or I don't think that they recognise their own name. And what they're really saying to me is my baby autistic? And that's sometimes what I'll say to them, is that what you're worried about? And I think there's quite a lot out on the internet at the moment about autism. And what I would say to most parents is that worries like that are very often unfounded. And what we have to do is just wait and watch and see what happens. But going in early with a diagnosis like that is very rarely helpful.
And I think that's lovely that you reassure parents like that, because it can be quite a stressful time. And sometimes babies do just need time to develop a bit further, and it doesn't necessarily mean anything that you need to worry about.
And there is so much information out there on the internet, which can be really scary.
Absolutely. And I think that's something that we both try to do in our roles, is to dispel some of those rumours and to try and reassure parents and give them the right places to seek information that doesn't include any of those scary things that we know are out there.
And I think the other thing that's really important is that obviously there will be some babies who are going to turn out to be autistic or to have developmental delay, but it's very rarely important to rush in and make a diagnosis. It's often much better to get to know that baby, to follow that baby, and see how things turn out.
Yeah, that's great advice. So something I like to do in my spare time is reading. And when my baby comes, I will be keen to read from the beginning. I, of course, won't be able to teach him how to read just yet, but I wondered, is there a benefit of reading to your baby from an early age?
Undoubtedly, I would say I would just start right at the very beginning and choose books that you actually want to read to your baby yourself. So I wouldn't go in with really simple things. I would go in with lovely fairy tales that you might remember from your childhood and that will make you feel nostalgic. Something that you'll enjoy, and what your baby will be doing is listening to the sound of your voice.
And in a similar vein, during the pregnancy, I have been singing a lot more and listening to a lot more music, as my mum said that was something that she did with me. And I think that's why, or I believe that's why I've developed such a strong interest for music. Is that also something that can be beneficial for baby, but also for mum?
Yes. I mean, I think singing is a great idea as well. And also just it's having things to do with your baby. As I've said before, when you've got a small baby, it's actually quite limited what you can actually do. So doing stuff that you enjoy and taking your baby on that journey with you is brilliant.
And did you find with your own children there were any particular songs or artists or sounds that they enjoyed?
Well, they all loved having lullabies sung to them at night. And I all have, right until they were quite old, I used to sing them lullabies. And what I noticed with two out of three of them, was that every time I sang a song that was in a minor key, when they were babies, they cried.
Oh, wow.
They just looked sad. They recognised the minor key. And if I'd sing a song in a major key, they'd be all happy and smiley.
Very perceptive children you had. So you discussed, Sue, about giving the child some time because things could change, and maybe not jumping to a diagnosis with symptoms that you see in your child. But if you do have a strong feeling that there's something wrong and you're concerned about something like autism, is it also not beneficial to seek that help earlier?
Certainly. So there will be some babies who, unfortunately, very early, there are very clear signs that things aren't right. And in fact, some early intervention with development support may be what is needed. And I would advise parents, if they really are worried about some things that they've noticed in their baby, to in the first instance talk to either their health visitor or their GP about whether this needs to be taken further.
So I think what the key thing to highlight here is that there's always help out there. And if you're not sure, ask the people who are the professionals.
Exactly.
And they can guide you in the right way.
Exactly.
I really enjoyed your episode on creating a stimulating and nurturing environment for your baby. And that's something that my husband and I hope to put into practice when our little one arrives. However, I have also seen babies of friends who have been quite distressed and they've told me that my baby's been overstimulated today. Is that such a thing?
That's a very good question. So I mean, I think that there's undoubtedly too much that you can offer a baby. So a baby does need some rest, does need some sleep, and you do need to pick up on your baby's cues. So I have seen parents who are just constantly waggling rattles in front of their baby's face. You must have seen the same parents. Just the baby's just lying there and they've just got this rattle here, and then they're constantly pulling away and moving them around. And actually all that baby needs is just to be quiet and maybe talked to and listened to. So yes, I think babies can be, and they can also be understimulated. So there are some babies who are just left in a corner and not interacted with at all. And both of those can be equally difficult for babies.
And I guess it's about finding a balance between the two.
Yes.
And that sounds like a challenge, but I think every baby will be different.
Yes.
And as your baby grows, you'll be able to pick up on those cues and find what works for you.
Exactly.
So on the topic of stimulation, something which we probably don't even notice so much these days is screen time stimulation. Now, you mentioned in your uni journey about the American Association of Paediatricians' recommendation that under twos are kept completely away from screens, with the exception of video chats with family members. Do we know much about the long-term effects on babies of all of this screen time?
I think the answer is we don't really know enough, but we can only guess. And it just seems instinctively wrong for them to be on so much screen time, partly because they're not doing other things. I mean, I'm always shocked by how many babies know how to use a phone. They can swipe things and they can find things. They can take a photograph of themselves. I mean, it's very scary, isn't it? But I have to say that as a parent of young children, there would be times when mine were tiny and I'd need to cook or do something and I'd plonk them down for half an hour or so in front of something on telly that was distracting. So I think you just have to, be realistic. And there will be times when screens will be really helpful, but not to rely on screens all day and every day for your children.
Yeah, of course. So I've seen with family members and friends' children, there's actually lots of useful educational content. So not all screen time is bad. And I think there is some good stuff for their development, but we have to be careful. And it's important that you know exactly what your child is watching, because there's also a lot of bad content out there.
Yes.
So something my husband and I have been discussing just this week actually is where to put things in our home, and particularly how long the baby might be with us in our bedroom, but also at what point the baby will then move into the nursery. Do you have any advice on this?
Yeah, it's very simple advice actually, and that is for the first 6 months of life, ideally your baby should be with you, and then you can move them into their own room. The other bit of advice, which is really important, is that they should have their own cot to sleep in, that they shouldn't be co-sleeping with you. And this is because a lot of evidence that shows that babies who sadly die of sudden infant death seem to hardly ever die in a cot. It's nearly always if they're somewhere else.
Okay, that's really useful to know. So 6 months in the bedroom and then to the nursery.
Some parents will go earlier, but 6 months is the current recommendation.
And is there any cues from the baby that they may want to be in a different room or should be?
I think most babies never want to leave their parents, actually, especially toddlers. So that's another reason to put them into their own room at about 6 months, when they won't have as much of a voice as if you decide to move them when they're 18 months. Then you'll have a real struggle on your hands.
Even if I want to keep them in the room.
Oh, well, if you want to keep them, that's a different thing.
So one of our popular journeys is covering the topic of swimming and getting babies and children into that. It's a really fun activity with so many benefits. And I just wondered if you had any other recommended activities for babies in their first year of life.
Well, I just want to start with swimming because I just want to say I really think every baby should learn to swim. It's for safety and also it's amazing exercise and fun. But other activities, well, I suppose it's all about exploring the world. So it's about learning how to climb, it's about learning how to jump, it's about tricycles. And I do recommend borrowing toys for young children, going to toy libraries, borrowing tricycles, because you can find you have an awful lot of kit that you don't use for very long.
And a lot of those activities are, as the name suggests, very active things. And of course, as little babies are super accident prone, you may have parents who are a little bit reluctant to allow their children to engage in those kinds of things. What advice do you have for them?
So it's hard, actually, isn't it? And the first time your child gets a cut and you see blood coming from them, it's just a very sad moment, really. So, yeah, but children have got, the only way they're going to learn is by exploring. And in exploring, they will sadly injure themselves. So make sure you're in an environment which is appropriate. So a playground appropriate for the age of that child. If they're on a scooter or bicycle, stick a helmet on the head. And try to give them a bit of freedom.
Thank you. That's really great advice. Sue, thank you so much for talking to us. I've had such a great time hearing all of your stories and sharing your expertise with us. Thank you.
Thank you very much. It's been fun.
And for more on anything you've heard today, as well as essential information and advice on your baby's first years of life, please visit Sue's baby development and baby health journeys at unii.com.